Senate Education, Finance, and Policy Committee will now come to order, and we do have a quorum for the record. Today, members, we have 5 exciting bills, and the first, we'll get right to it. The first up is Senator Nelson, Senate File 707. Are you with us? There she is.
Yes.
707. You have any amendments, Senator Nelson?
No, I do not, Mr. Chair.
Okay. Well, you may proceed. Go ahead.
Oh, thank you, Mr. Chair. Thank you, Chair Chamberlain, and members of the Education, Finance, and Policy Committee. Thank you for hearing Senate File 707 today. Before I begin, I also would like to thank the co-authors, Senators Dornink, Champion, Draheim, and Senator Pappas. Some of you are familiar with the education partnerships. The members are Austin Aspires, Cradle to Careers in Rochester, Every Hand Joined in Red Wing, Generation Next in the Twin Cities, Northfield Promise, Northside Achievement Zone in Minneapolis, and St. Paul Promise Neighborhood, and the United Way of Central Minnesota, which serves my community, which serves the community in the St. Cloud area. The coalition engages more than 120,000 youth and their families across Minnesota. Coalition members take a birth to career approach to eliminating Minnesotans' worst in the nation opportunity gaps. All coalition members are locally controlled, data-driven, public-private partnerships. This collective impact focus brings communities together to enact solutions that improve outcomes for children and families. This unique coalition with both the urban and the rural members has been recognized as a national leader in collective impact. I know that's something this committee is focused on. This year, the EPC members have served their communities through COVID and in the face of continued challenges. Members have led in ensuring hundreds of students have devices, Wi-Fi access for distance learning, distributing thousands of boxes of food, and providing hundreds of thousands of dollars in emergency rental relief. Despite the coalition's efforts, families across the state continue to struggle. Without swift, bold action, our families are in jeopardy of falling further behind. We know that now is the time to invest in our students, to invest in our parents, and invest in our communities so that 2 generations of Minnesotans can thrive. Mr. Chair, I'd like to turn it over to my testifiers at this point.
Thank you, Senator Nelson. I have 2 testifiers. First up is Sandra Samuels, and then Marissa Ding.
Yes.
I think Ms. Samuels, welcome to the committee. Please state your name for the record. And
yes.
Thank you.
Thank you so much, Chair Chamberlain and members of the committee. My name is Sandra Samuels, and I am the president and CEO of the Northside Achievement Zone, a proud member of the EPC. And I want to thank Senator Nelson for being our chief author of this important legislation, along with the bipartisan group of co-authors, and she mentioned some earlier. And thank you so much for having me. The Northside Achievement Zone exists to permanently close the opportunity gap and end multi-generational poverty in North Minneapolis. We're really focused on the power of place. We believe that where the greatest opportunity gaps are in our state, that should be ground zero for where the solutions come from. Together with our partners, organizations, and we're partnered with about 30 organizations in housing, health, career, early childhood, K-12, after school, summer, colleges, and then we do a whole host of parenting education classes. And I'd love to, I know Senator Nelson has seen it 100 times, but this is really our ultimate goal, is that at the end of all of our work, and we hope there is an end, that our youngest babies will be college graduates. And this is when, actually we need to update and have 2042. But we're all working, and our whole, really our theory of change is that schools can't do it alone. And families and children are at the center of the work that we do. And our wraparound support is also wrapping around the schools. And nothing has been more important. And we've had amazing outcomes Not good enough. I mean, I still lose sleep over them. I mean, our kids have the achievement gap, the racial achievement gap is real. But when you look at our data, and Wilder does all of our external data, and I can share whatever reports you all would like to see. We're about to release our most current report. There is a statistically significant difference between the academic outcomes of children who are getting this wraparound support versus the children who are not part of our collaborative. It's significant, even though the numbers are still low. And while we have been working in earnest, COVID hit, and it is threatening to take us further behind than we were before. And I think all of our partners across the state who are doing this place-based work are feeling the pain of that. And then for us in particular in Minneapolis, the murder of George Floyd and the riots that followed, and the just unchecked wanton violence that we've been seeing in our community. And now with the trial coming up March 8th, our children are being traumatized. I've been living in my community where I'm serving for about 24 years, and I've raised children here. I'm actually grateful that they're all off to college. I just have one young man who's living with us, but he's about to graduate too. So we've pivoted this year in terms of with C-19 and with the murder of George Floyd, and our families who are disproportionately African-American. We serve about 800 families. 1,700 scholars, and many of them were the workers who got let go. Many were struggling with how are they going to pay rent, a lot struggling with depression. I mean, this all came up. And Senator Nelson, I think you might remember Samara, who was a mom who used to come to the Capitol all the time. And I think she testified in one of your committees. Samara, a mom of 4, Naz, lived on the north side, had asthma, was dealing with a lot of our parents, particularly mothers, are talking about depression right now and with their children. And Samara died 2 days before George Floyd was murdered from an acute asthma attack, which is absolutely avoidable. And so anyway, this thing is real for us. So and then of course the homeschooling, and that's what I'm calling it, that it's been, the kids who have been most left behind just haven't done well in this distance learning. And I'm not saying that desperately enough. So here's what we've been doing, and this is how we pivoted. We gave out about $300,000 in direct cash funds to families, both NAS families and our partners' families. We were really, whatever families had children in school, we were really trying to support. About $225,000 in rental relief through our partners. And this is the amazing thing, is that this wraparound support, we've been doing this for close to a decade now. So we didn't need to build trust with our partners when this emergency hit. We were able to hit the ground running as a collaborative, and just like, okay, what are the needs in housing? What are the needs in jobs? What are the needs here? And I mean, and our education partners were right there as well. And then we also we're partnered with Second Harvest Heartland, North Point, Appetite for Change, and we are running a Northside food delivery program. We've delivered to over 130 families. They get both groceries. The next week they get restaurant style meals. Transportation and getting to where the food was a huge problem for our families. We did 2 surveys, Wilder Research, surveyed our families twice. And if any of you would like the survey results, and that's where we found out that transportation was an issue and that our families were so food insecure. We are going to ramp that up to 300 families getting the service. We've given out 1,100 Chromebooks, 1,300 noise canceling headphones. People who are living in small quarters with more than one child, doing work is a challenge. We've given out 165 access to broadband. Our goal is 1,000. from families. We buy it from Comcast. We have a tutoring program, and we are slated for 400 students. We're focused on the summer right now. We have given out over 140,000 masks. In terms of mental health, our key partner is Washburn Children's Center, and they've gone to telehealth. And I don't know the exact numbers of families that have started because they can see more people because of telehealth. I don't know the exact numbers because of privacy issues, but we know that it's been a great resource and that more of our families have elected to be supported by it. And we have a PR campaign right now. Our community is vaccine hesitant. And so we are working with North Point and a number of places, but like just blasting the North Side with the messages around staying safe. And we're giving out thousands more masks, but also the importance of getting vaccinated. And we will continue to do this, again, really partnering with our schools and our families and our children. We need each other more now than we ever have. And in closing, I'd like to say, Chair Chamberlain and committee, that, I'm proud of the work that we've done, but there's so much more to do. And Senate File 707 will enable us to provide a deeper level of services and for a greater number of families. And this is across the state. Please invest in our children and families with this innovative approach. And we know that it's innovative. And we are on the ground meeting the needs of the children and families who need partnership the most. Thank you so much.
Thank you, Ms. Samuels. Thank you very much. Next up is Marissa Ding, Cradle to Career. Welcome to the committee. Please state your name for the record and who you're with. Thank you. Good. And you may go ahead.
Yeah, thank you so much for having me. Chair Chamberlain and members of the committee, my name is Marissa Ding, and I'm the student representative for Rochester Public Schools Independent School District 535 on the leadership table of Cradle to Career of Rochester, Minnesota. I'd like to share my experience growing up in a very diverse academic environment and the impacts that organizations like Cradle to Career have had on my school. I go to John Marshall High School in Rochester, which has a roughly 40% minority student population and a high number of low-income students. So I've definitely witnessed firsthand the direct impacts of educational gaps amongst marginalized groups. Our Black, Latinx, and Southeast Asian students graduate with significantly lower ACT scores and overall college preparedness levels. This translates into the way my community views my high school. Not only is my high school called the bad school in town, but it's also referred to with terms like dangerous. And these descriptors are really limiting. Walking through the hallways of John Marshall, you sometimes feel that students have given up, whether that be in terms of academics, sports, or even their future careers. And people are okay having 2.0 GPAs and not being involved in school activities because they get stuck in that mindset that they won't amount to anything because they go to John Marshall High School, and they just become okay with that. And this problem is most prevalent amongst our minority and low-income students. Organizations like Cradle to Career are working to overcome those educational gaps and uplift marginalized students from those labels. My school is a community school, and its partnership with Cradle to Career has allowed it to secure greater funding for its initiatives and extend further outreach in my town as it connects with local partners and spreads awareness of its cause. For example, my school has a program where students can take backpacks full of food home on the weekends. These efforts would not be possible without sustained investment from Cradle to Career and other groups that are centered around racial and educational equity. Growing up East Asian, I was really lucky to have parents who were engaged in my education, but a lot of my peers are not able to say the same. A lot of people like to reduce educational disparities amongst different racial groups to things like poor work ethic, but something I've learned from going to John Marshall is that lack of parent-student engagement, access to academic resources, and other related issues are what is really contributing to these disparities. John Marshall has always struggled with securing enough funding to support its staff and students, even though we have a great need for it. We call our student body our Rocket family. It's always been about caring for and supporting each other through our high school careers and progressing in spite of the terms used to limit us. We've seen the amazing impacts that partnerships with Cradle to Career and others have had in our building, and we hope that this care for our kids will be echoed in continued state-level funding. The state investment made in Cradle to Career is working. We thank you for that and ask for you to pass Senate File 707 to continue the efforts for not just our Rocket family, but for all children who deserve a chance to soar. Thank you so much.
Thank you very much, Ms. Ding. Senator Nelson, I got a question for you.
Yes.
Couple. So how long, well, maybe Ms. Samuels, well, I'll ask you first. How long is this, do you know how long this partnership's been operating, this program, EPC? Senator Nelson, do you know?
Yeah, Mr. Chair, the Northside Achievement Zone was the first educational partnership coalition member. And I cannot tell you exactly, they've been working together since 2016. And I will say during that time, I'm sure you're probably aware, Mr. Chair, and maybe many of the members are as well, the results have just been phenomenal. And then it has also expanded from those original sites to some of the others that I mentioned earlier. And Cradle to Career, I believe, is in its second year, but our testifier, Ms. Ding, could probably confirm or correct that.
Thank you, Senator Nelson. Ms. Samuels, how long has NAS been in operation? You were the first of the partnership?
Yeah, actually, we were of the Education Partnership Coalition, but St. Paul Promise Neighborhood preceded us by a year. And but we really got going in earnest in 2011. Like we started working, right. I'm talking about just the Northside Achievement Zone.
Right. But NAS is a coalition of these nonprofits, right?
Yes, and schools.
Or you've been going since 11. So we've been probably funding these since 2016. Maybe Ms. Hoffer or Ms. Jill said, Ms. Hoffer, do you know how long we've been funding these?
Thank you, Mr. Chair, for the question. I do know that the Education Partnership Coalition Fund was created in law during the 2017 session, and funds were first appropriated in fiscal year 2018. I'm checking to see when appropriations first went out to the Northside Achievement Zone in St. Paul Promise neighborhood, because there were a couple of appropriations prior to the Education Partnership Coalition Fund, and it looks like 2016 was the first year for those.
Okay. So one other question then for Ms. Hoffer. What's the current funding for these tier 1 and tier 2? I know tier 3 is new, but what's the current funding?
Thank you, Mr. Chair. The current funding for the tier 1 is $1.3 million for the Northside Achievement Zone and $1.3 million for the St. Paul Promise neighborhood in each fiscal year. And then for tier 2, the funding changed a little bit from the 2021 biennium to the 22-23 biennium. So for the 22-23 biennium, funding goes to, I believe it was $480,000 and per year, and then that would be for competitive grants. So this bill would keep the funding at the 2021 levels of $250,000 per named recipients, and it would add the Generation Next Promise neighborhood.
So current funding for the two pieces of tier 1 is 1.3 and 1.3, so 2.6. And then, okay, all right. Well,
Mr. Chair.
Yeah.
So in total, that adds $3.85 million per year across tier 1, 2, and 3, plus administrative funding.
So the administrative funding goes where? Who knows that answer? Does that go to NAS directly or?
I believe that goes to the Department of Education to administer the grants. So that would in part go for the tier 3 planning grants, I believe, since those are competitive and those are not named recipients.
All right, so the tier 3 is a new tier, and those would be competitive grants, where the others are just going to those organizations and then they manage the cash themselves. Okay, all right, that's all I had. Thank you, Ms. Hoffer. Members, any other questions? I see Senator Uyghur, you have a question.
You're muted.
Muted, Senator Uyghur.
Okay. Thank you, Mr. Chair. Thank you, Senator Nelson, for carrying the initiative. It is proven that it's going to close the opportunity gap, and the evidence has been clear. And I have authored or co-authored this in the past. There's been strong bipartisan support. All of us agree that this is a shared goal, and I'm wondering if there might be, maybe perhaps Ms. Hofer could give us a dollar amount as to what the investment would be if we have a proven solution for wraparound services, something Ed Minnesota has strongly advocated as well for full service schools, wraparound services that Ms. Samuels talked about. They agree this will close the opportunity gap. So if we know that, what would the investment be if there seems to be bipartisan agreement on these remedies, recognizing that it's targeted pretty much at students in poverty and their families. So I wouldn't expect you to have an instant answer, but we can make incremental allocations for these programs, which is fine, but it seems the evidence is in, and the need continues to be the number one item we address each session. So Ms. Hofer or anyone.
Thank you, Senator Uyghur. It is a big and complicated question, too much to deal with at this point. So thanks for the insight. Senator, anybody else had a question, comment? I'm seeing none. Senator Nelson, you want to wrap up?
Yes, thank you, Mr. Chair. I know your time is so precious in this committee, and I just appreciate that. I would just close saying that I know that this committee is focused on funding what works. And we know that this model works, and it has been replicated over and over because it works. And the thing that is so impressive to me is that it is data driven. And if you've not been involved, I'd encourage you to visit a site and have a meeting about the data. The data is remarkable, and their solutions are driven by the data. The other important thing about EPC partnerships is they are that. They're just that. They're partnerships. So it requires non-state money. And so it is that blend of public-private partnerships. And then, of course, as was mentioned earlier, it's family focused. And we know the strength of the family in empowering children. So, Mr. Chair, I just thank you for your time. I know you have many challenging decisions. I ask that you keep this proven successful model in mind as you go forward. And Mr. Chair, was there a motion that you needed someone to make? Wasn't sure on what your plans were for this bill.
Well, we'll just hold it over possible inclusion. Yes, no challenges here, Senator.
Thank you so much, Mr. Chair. Thank you, committee.
So, members, with that, Senate File 77. Thank you, testifiers. Thank you very much, Ms. Samuels, and thank you, Ms. Ding. Thank you. And with that, Senate File 707 be held over possible inclusion. So next up is Senator Dornink with Senate File 987. Senator Dornink, must ask, is this your first bill?
That's actually second.
Dang, hoping to get the first one. All right, well, you don't have any amendments, correct?
Correct, no amendments, Mr. Chair.
And you have no, do you have any testifiers with you today? Are you going?
No testifiers, don't.
Wow. All right, well then, you may kick it off with Senate File 987. Tell us what you have.
Well, thank you, Mr. Chair and members. This is Senate File 987. It's evidence-based education grants. This bill would bring more accountability to pre-K education related granted fund programs. It does this by creating a process to measure the effectiveness of the program. We invest millions of state dollars every year funding education related programs that is outside of the realm of our public schools. Basically, these programs come alongside our schools to help educate children. Many of these programs come back year after year to ask for additional grants. You may have heard great programs like Reading and Math Corps. They are wonderful examples of great programs that provide solid evidence feedback to our committees. They show the impact they are having on our students' education. Having database feedback like this allows our committee members to make better decisions on where to focus our grant dollars. This bill would require pre-K-12 education-related granted fund programs outside of the school district to provide a simple report at the end of the grant cycle. This report must contain one, an education goal, a summary of the strategies used to reach the goal, the data collected, and a summary results. The report can be very simple, just a 1 to 2 pages, and must be submitted to the Commissioner of the Education and to the chairs and the ranking minority members of our education legislative committees. The purpose here is not to create a litmus test or a single indicator for who should or should not get funding. This is just to create a tool for our committees to help make a better informed decision when funding education programs. It will also help get groups and organizations to think in more evidence-based way. It will help us determine the successful programs that we want to see duplicated throughout our state. That's just a brief summary, Mr. Chair, if there's any questions.
I have one. I understand Reading Corps currently does this, correct? I know that we have some out there that currently get information and give us data back.
Correct. Reading Corps and Math Corps do that. And I don't know if you guys got a paper of that, or does everybody member get one or not?
Yes, we do.
Okay.
We have it here.
Right. Thank you, Mr. Chair.
Yeah, at least I have it. I hope everybody else has it. Yes, they all have it. All right, Senator Isaacson.
Yeah, in terms of like how this is operationalized, do you use the grant funds also to pay for the report and data compilation? Is that covering that or no?
Senator Dornink.
Senator, or Mr. Chair and Senator Isaacson, I'm not aware of where if that would be included, but there's not going to be a lot of cost there. It's just a simple 1 or 2 page report. It's not something that we're trying to make it expensive. Just a little report like teachers do today. And, that's what they do. They set a goal, they have a summary, and that they collect it, and then it's just a report that would become to the members and the commissioner, just to kind of go over how things are doing, how to make it more effective.
And
Senator Isaacson.
Yeah. So did some teachers or administration come to you saying they wanted this bill?
Yeah, this has bipartisan. Oh, sorry, Mr. Chair.
I was going to say this is for the. It would be, for example, any nonprofits, any grants we give out. We give out a lot of one-offs. Whether it's Santa Corporation, Santa program, or others. That's what you would be referring to, right, Senator Dornick? Different grant programs that we give money to, they'd have to.
Yes, Mr. Chair, correct. And
right, I was just wondering if any education people that do this for a living in education, did they ask for this? Or...
Senator Dornick?
Mr. Chair and Senator Isaacson, yes, I actually am carrying the bill for a school teacher from the House, and it's got bipartisan support, and it's already been through the policy and finance ed committees. And so, yeah, it's got bipartisan support. Thank you.
Mr. Chair?
Senator Isaacson.
That wasn't what I asked. I mean, I get it, and I'm not even saying it's a bad bill. I'm just wondering, did stakeholders that are educators or administrators or groups outside of the legislature ask for this bill? I'm wondering where the impetus came from.
Senator Dornick, or
did you come up with the bill yourself? I'm just curious as to where it came from, that's all.
What was the impetus for this, Senator Dornick?
It was a House bill that was actually last year probably would have passed, but just with the COVID-19. So this isn't a new bill. This is something that's been out there. And so I'm carrying it because I support education or evidence-based. I think it's a good way. We want to make the best investment for our kids with state dollars and what works best for the kids to help them succeed. If we need to make adjustments, minor adjustments, we want to do that to be most effective with our dollars. So again, I got the bill from a House member. It's been through some committees, and it's got bipartisan support.
Oh, currently, Senator Dornick, you don't know who had the idea for the bill?
Yeah, it was Representative Bennett.
Okay, we don't know who she got it from. Okay, I guess we'll have to find it out. We can find out, Senator Dornink, let me know, and then I'll share it with the committee, or you can share it with Senator Isaacson.
Thank you, Mr. Chair.
All right, thank you. Anybody else? Senator Kunish.
Well, I can actually answer that question
Oh, great.
because I heard it last year in our education policy. I was the vice chair of that committee, and yes, Representative Bennett brought it and introduced it to the committee. So she, being a former teacher herself, felt that it was really important that we have this this kind of accountability. But one of the questions I had then and the questions that I have now, when all of these different organizations are creating these reports and they're submitting them to number one, to who is reading them and evaluating them to see if they're meeting the goals that they had asked for that funding for. And then number three, what are any consequences to it? If they actually meet or exceed their goals, is there some kind of a gold seal, or do they go at the top of the list for reconsideration? Or if there are programs that didn't meet those goals at all, is there some kind of accountability for that? Like, well, where did you use those funds? Where did you fall short? What were the resources that weren't available? What did you learn from that? So while this is really important, just like, you know, we hold our teachers and our kids to feet to the fire to show that they're making progress or that they're using the best funds possible for reaching the goals that they are expected to achieve. You know, who's reading these? How are we evaluating them? And then what is going to be the outcome? Is it just like, oh, here it is, it goes into a file, there it is?
So Senator Dornink, you want to answer that? If not, I can. Go ahead.
Mr. Chair and Senator Kunish, thank you for the question. So yeah, on the back of the bill, it says reports must be submitted to the Commissioner of Education and the chairs of the ranking minority members of the Legislative Committee. So that's who it's going to be to, is the Commissioner of Education, and then it's also going to be to the chairs. So the people, well, the legislative back to us, you, to, so that's who's going to be reading it and seeing it. The second part of the question was, what's going to happen? Well, it's just an evidence-based education grant. So that would be what we do, is we hear the needs of the people of Minnesota, and then we decide where best to use that money. So that would be back to the committees, and specifically the Education Committee would make that decision.
So subdivision 4 in the bill talks about reporting who gets it, timing who gets it, and then, you know, then the committees evaluate whether or not they want to renew that funding. Senator Kunish, anything else?
Just a little bit of a follow-up then. Chair Chamberlain, if you were to get one of these reports, then it would be your responsibility to read it, evaluate it. Would you then feel like it was important that you would share it with the rest of your committee, or would you imagine that it's just sort of you have your own ability to share or not to share, evaluate or not to evaluate?
Yes, I would get the report, and I would, assuming I'm here in the next 6-10 years, God help me if I am. But yeah, we go to the chairs, and it'd be their discretion and the MDE to review those reports. We get a lot of reports from different organizations that come, as you know, Senator Kunish, they come to chairs of the ranking of the committees with authority for review, whether it's tax or education. And you know, the EPD, the partnership, the one we heard earlier, partnerships, that they had a report. So yeah, they come to the committees, and then the chairs, whoever's the chair, has the discretion to do what they will with them. Hopefully something wise. Senator Swedinsky.
Thank you, Mr. Chair. Not a question, just a comment. I hope I don't know. I'm just we're at the risk of sounding like I'm against collecting of data. The compilation, analysis, collecting data. You know, we're talking about kids here. We're talking about our students and their emotional and social and the holistic needs of our kids. And I'm kind of hoping that, you know, COVID-19 woke us up, that maybe there's more to educational system than just further collecting data on our kids. And so it's more of a statement. I hope as we go forward in committee, you know, maybe we, instead of saying collecting data, we should use a phrase like finding out more information about where our students' heads are at, instead of talking like they're not even human beings with that need their needs need to be nurtured, and helping them find a purpose in life and all the things that our teachers are so busy doing. So anyways, it's just a comment as we move forward. Thank you, Mr. Chair.
Yeah, thank you. We collect data on a lot of stuff, and believe me, I've been an opponent of collecting data for years, but no one listened to me on that. We're going to wrap up. We got to move on.
Hey, I'll listen to you.
I'll listen.
And we got to move on, Senator Uyghur. We've been too long in this particular simple bill. So with that, Senator Dornink, you got 15 seconds to give a wrap up.
Well, in closing, just this bill would simply create a simple process to measure and report the effectiveness of the programs that receive pre-K-12 education grants. Everyone wants their tax money used wisely and to support programs that work. This is one idea to make this happen. Thank you, members, and thank you, Mr.
Thank you, Senator Dornink. So with that, Senate File 987 will be held over possible inclusion. So next up is me. So I'm going to give the proverbial gavel over to Senator Eichhorn. I have, the committee is now yours, Senator Eichhorn.
Thank you, Senator Chamberlain. Welcome to your committee. We've got Senate File 783 up, and that's dealing with community education revenue increases and the advisory council modifications. So hand it over to you, Senator Chamberlain. And then we've got Wendy Webster after Senator Chamberlain's done.
Thank you, Mr. Chair. Members, this is a simple bill. You know that we currently have community education organizations part of the public school system. This bill doesn't create a new council, but in essence, what we're trying to do is, to Senator Swedinsky's point and previous bill, create a little more accountability here and encourage these organizations to work with these other, like for example, SANIC or the Santa Foundation or a program, or others out there that come, you know, as many of you have experienced in Uyghur as a chair, they come up to us as a one-stop shop and want us to write a check, and it's pretty easy because we're just a single stop. But community ed offers a variety of resources. So this creates kind of a little accountability in subdivision 2, paragraph B, talks about a little bit of a accountability, not heavy. It's just to a process for them. They don't have to report to us. It's a process for them to receive and review feedback and input, so that we might get a better understanding of programs, give other programs and operations an opportunity to occur at that level. And we increased the funding a little bit. There is some cost to this. It's not as much as I would like. I'd like to do more if we could, but we will find that out. So not a lot. There is an aid component. So when we increase the cost, there is an aid component. The aid component would be an equalization. If they seek it out, then we would equalize to a certain amount. It'd be nice to give a little more money into this side of it, and we might be able to do that. So that's it. Just a little extra add-on for the community ed services we already have to encourage a little accountability and to bring in other programs that we might not have to deal with at this level that might be targeted at particular districts. is a way of kind of loosening things up and and a little more flexibility out there too. So that's it. No amendments on this one.
Thank you, Senator Chamberlain. Wendy Webster, go ahead and just unmute yourself. Make sure to state your name for the record and share your testimony with us.
Thank you, Senator Acorn. My name's Wendy Webster, and I'm here on behalf of the Minnesota Community Education Association, and we support Senate File 783. Thank you, Chair Chamberlain, for introducing this bill, and I appreciate the opportunity to share a little more with all of you on the Senate Education, Finance, and Policy Committee. So as you know, Senate File 783 modifies language and provides a slight increase in funding to the general community education revenue. I serve as the Director of Community Services and Communications for the St. Anthony Brighton School District. Although we are located in the 7-county metro area, we are a small school district and we face similar challenges to small school districts across the state. And each year here in St. Anthony, our general community education levy generates $53,365,000, which has remained flat since 2005. The amount is determined by multiplying what is currently in statute, $5.42, by our census count of 9,846 residents here in the St. Anthony Brighton School District. Funding actually decreased in 2003 and was partially restored to the $5.42 in 2005, where it has remained flat for 15 years. In the proposed bill, the levy would increase to $5.97 for every person in our district. This would restore our funding to the level it was in 2002, when the general community levy was $5.95 per person. So our school district's general community education levy would increase to just over $58,000, an increase of about $5,415. I share this example to not only highlight how the levy increase will impact our district, but to emphasize that 75% of school districts in the state are our size or smaller. In Minnesota, 75% of school districts in Minnesota have a census population of 10,000 or less. So this example helps the committee understand the fiscal impact of small school districts across the state. Our community ed budget here in St. Anthony is approximately 80% fees and 20% local levy and state aid. Of the local levy and state aid that we do receive, the general community levy is the one that gives us the most flexibility. And we use those dollars to help cover costs to employ people to coordinate the programs which serve our families, children, and empty nesters in our community-based programs, and also develop partnerships with organizations in our community. When I look at the language revisions regarding our advisory council, I can share our budget process here in St. Anthony. In April, I present a proposed budget to our Community Services Advisory Council. And together, this group of stakeholders and we walk through every program budget. And I use that opportunity so they are aware of each community education program, how it's funded, whether it's funded through participant fees, state aid, and or local levy. As you are probably aware, in community ed, things like school readiness aid, ECFE funding have to be used, and ABE funding have to be used in very specific purposes. So we discuss the purpose of the program, who it serves, and then also the statute limitations. Again, the general community education levy provides the funding to coordinate our community education programs, including our school-based adult recreation and enrichment programs, all of our youth programming for grades K through 12 outside the regular school day that doesn't include our high school activities and athletics, our early childhood programs for children birth to age 5, including preschool, and our early childhood family and parent education programs, childcare for preschool and school age children, and in the past year in particular, Tier 1 childcare. And then it also helps fund the community use of facilities and staff that can help ensure that our community can reserve our school district facilities and use it. In addition, we also engage our residents to identify and address issues that are important to our community and create those partnerships to benefit students, families, and our residents as a whole. Like community education programs across the state, we pride ourselves in offering high quality programs at an affordable cost, from our youngest learners to our senior citizens. And just to sum it up, increasing our general community levy would give us more ability to engage our communities and provide high quality, affordable programming for all of our residents.
Thank you, Ms. Webster, for your testimony. Are there any questions from members for either Senator Chamberlain or the testifier? Senator Uyghur?
Yes. Thank you, Mr. Chair and members. It's just a strong endorsement for the bill, and I relayed that to Senator Chamberlain earlier. Community education is lifelong learning. It provides the earliest opportunities for young parents, all the way to Meals on Wheels for families that need senior citizen involvement. My personal involvement in the entire legislative process started on the community education issue. And as an intern in college at Hamlin, I interned for Senator Jerry Hughes, who was the president of the Senate and the chair, like you, Senator Chamberlain, of the Education Committee. And it was also Dr. Hughes, and his vision was for a community education program that someday would become what we have now. And I was so inspired as an intern. I ran for school board and said we should get a community ed program in North St. Paul, Maplewood, Oakdale. And today, districts throughout the state have robust programs and they're successful. I so much appreciate all that has happened, and the investment is a great return for the community, and it's overdue. So thank you for bringing it, and thanks to everybody involved in the grassroots effort through the advisory councils. You're doing a great job. Thank you, Mr. Chair.
Seeing no other questions, final comments, Senator Chamberlain?
Yeah, thank you, Mr. Chair, members. Thank you, Senator Uyghur, for the support. I did get that notification into the desk, by the way. Yeah, if we can, it comes on the cheap too. Maybe there's more we can do with this as we move on. So thank you for the support. That's all I have, Mr. Chair. Thank you, Ms. Webster, for the testimony as well. Thank you very much.
All right, thank you, Senator Chamberlain. With that, Senate File 783 will be laid over for possible inclusion in your omnibus bill. Next up, we're going to have Senate File 628, dealing with the state assessment plan for the spring of 2021. To your bill, Senator Chamberlain, and then for testifiers to get ready, we've got Josh Cruson and Shayna Morse after Senator Chamberlain's completed his bill introduction. So,
yeah, thank you, Mr. Chair and members. It's pretty straightforward with the one of the goals here is to ensure we know where kids are at, so we know what has to be done as we go forward. Nobody likes testing, especially under these circumstances. MCAs were waived last year, obviously, for obvious reasons. But we must find out where the kids are at so we know what we got to do to move forward. We know that there is catch up to do, but it helps a lot more if we have firm, clear idea of what it is we have to do and how far we have to go. So again, nobody likes tests, but this is directing the Minnesota Department of Education to develop and make sure the MCAs and to make sure that they move forward with the plan and any contingencies or alternatives due to remote and hybrid situations. It will not be easy, I admit, but we simply must find out where these kids are at. So that is, and Mr. Chair, the intent is to take this to the floor when I move it at the end of the testimony. Thank you.
okay, thank you, Senator Chamberlain. First up, we have Josh Cruson from Ed Allies. Just unmute yourself and please state your name for the record and go ahead and give us your testimony.
Yeah, thank you, Mr. Chair. My name is Josh Crossan. I'm with Ed Allies. Ed Allies is an education advocacy group dedicated to improving education outcomes for all students. I'm here to support SF 628, which requires MDE to develop a plan for schools throughout Minnesota to administer assessments through distance learning, in-person, or hybrid models. With our test designers, we know that MDE has the ability to do this. I believe this legislation will instill in them the will to do this. I usually start what seems to be annual conversations about the need for student data with what we know about Minnesota students. That only 1 out of every 3 students of color can read at grade level, that while high school graduation rates are increasing every year, our high school graduates are dropping further and further behind in math every year, that our race-based gaps have widened so much that homeless white students are now outperforming Black and Native American students in reading and math in Minnesota. I usually start this way, but now I can't today. Why? Because we just don't have that information. The MCAs are our state's only window into how our students are learning and doing, and through distance learning and impacts through COVID. We need that information now more than ever. Last school year, Minnesota prudently decided to stop the MCAs temporarily. I believe that was the correct decision at the time, but it came at a significant cost. We simply do not know how kids are doing now, and any policies around catching kids up wouldn't be based on what we've been able to measure. We have no idea how many fourth graders can read. We don't know how many high school seniors can do math at grade level. We don't know how many students grew over the course of this school year. We simply do not know how our kids are doing, and that is completely unacceptable for the state. I hope we can elevate the conversation in future years and get to a place of how assessment data can be actionable, and work for parents to help them advocate for their kids, and work for teachers to help them give them an understanding of where our kids are and what they need to do to close gaps. Until then, I implore you to protect this information and keep students and their learning at the center of our education system. Senator Chamberlain, thank you so much for introducing this legislation, and I'll be available for any questions. Thank you.
Thank you for your testimony. I have Shauna Morse up next. Please just put your camera on, state your name for the record, and go ahead.
Thank you. Good afternoon, Mr. Chair, members of the committee. My name is Shana Morse. I am the Assistant Director of Government Relations at the Department of Education. Thank you for this opportunity to provide comments on Senate File 628 today. So first, I want to say that we understand that there are safety concerns around in-person activities. We have worked closely with our partners at the Department of Health on health and safety protocols around these in-person activities, including assessments, and have been in communication with assessment coordinators with updates. So my comments today will be focused on the nature of the challenges right now around remote testing. By way of background, the MCAs measure student achievement related to the academic standards in mathematics, reading, and science. The assessment process requires a high level of integrity in order for the results to be considered valid. Assessment results that are not valid should not be compared or combined with valid results, and thus do not serve as an accountability measure. The traditional in-person assessment environment is highly secure. In-person assessments are secured physically through a controlled environment that includes a proctor, the absence of resources or materials such as phones or notes, and the oversight of the actual test materials to ensure that they're not taken, copied, or distributed. For remote testing to be equally as secure as in-person testing, additional structures are required. These additional measures might include something like video or web monitoring. These structures are not currently in place to create a secure remote testing environment and are quite unlikely to be in place when the testing window opens March 8th. We are not aware of any other state that is conducting assessments remotely at this time, likely for these very reasons. At this point, if Minnesota students did take the MCAs remotely, those test scores would not be considered valid and subsequently would not be able to be compared or combined with those taken by students in person. So as I mentioned, additional structures are needed for remote testing to be secure. Understanding the landscape, we at MDE did start exploring in a limited fashion what a remote option could look like, starting in late fall through this winter to look at some of the challenges of implementing remote testing. We looked at things like whether students have the bandwidth to view all of the content, or a fourth grader, would they know what to do if they were unexpectedly encountered technical difficulties. Ultimately, the limited field testing didn't provide what was necessary to implement a complete and secure statewide model. So the department is committed to the work around remote testing to ensure that all of the necessary policies and procedures are in place for assessments to be delivered securely. And in fact, the governor's policy bill, Senate File 788, would require the department to begin formal work on establishing parameters and policies needed to do just that. And that concludes my remarks. I appreciate the opportunity. Thank you very much.
Thank you for your comments. I see Senator Chamberlain has his hand up for additional comments. Then I have Senator Isaacson after Senator Chamberlain.
Yeah, just a quick note, members and Mr. Chair, you should have received in the emails in your packets a letter also from Excel and Ed supporting this idea as well. Thank you. That's all I got. Ready for questions.
Thank you, Senator Chamberlain. I've got Senator Isaacson, then Senator Kunish.
Yes, Senator Chamberlain, what this bill is doing is asking the Department of Education to create contingency plans for providing for the MCA test be cited in person. Is that essentially, is that a statement that's fair to say? I want to make sure, at first I thought you were trying to say you have to do them and, well, it's already required to be done. So I just want to make sure I understand it.
It is, thank you, Mr. Chair. It is a couple of things, you know, that currently is law and they were waived last year. We want to ensure that the department and the state understands the intent of the legislature is that the kids need to be assessed. And secondly, that we need to give them the authority and encouragement to do what they have to do to get those assessments done.
Senator Isaacson.
Yep, I have a question for the last Shannon Morris.
Ms. Morris, are you still on?
I am here.
Thank you. Does this bill give you authority? Is there anything in this bill that, how do I say this? It is my impression you already have all the authority this bill is trying to give you. Is that fair to say?
Ms. Morris?
Mr. Chair, Senator Isaacson, I am not sure that we have the authority to conduct remote testing. I think I would want to go back to the team and talk about that.
Got it.
But
okay.
the point of our comments today are the structures that would require for those results to be valid. And so if the students were to go through, if those structures were in place for them to actually take the test, again, we would need to make sure that the mechanisms or the measures are secure enough for those results to be considered valid and combined with the students who did take the assessment in person.
Senator Isaacson?
So, and then another question. So, is there anything from the federal government mandating you to do them online or like remotely?
Ms. Morris?
Mr. Chair, Senator Isaacson, there is nothing from the federal government mandating that they be done online. The federal government determines if they issue waivers for the assessments. And this year, a broad waiver like was done last year and was mentioned by someone has not been granted.
And Mr. Chair?
Senator Isaacson?
And to my knowledge, Ms. Morris, if I said that right, apologize if I didn't. And I'm just repeating to make sure I understand this correctly. The only person that can waive it is the federal government, correct?
Ms. Morris?
Mr. Chair, Senator Isaacson, that's correct.
So you have no authority to not give the test?
Ms. Morris?
Mr. Chair, Senator Isaacson, that is correct.
Okay. I share Senator Chamberlain's concern about making sure that they are assessed. I am concerned about kind of the intent this is going along and what it's sending. I feel like there's a way to make that happen without having to pass legislation about it and having that discussion and figuring that out. It seems to me like there's kind of a disconnect over whether or not we believe MD is being honest with us about whether or not they can pull off remote testing. And I'm going to defer to MD on that and have to say that as much as I share the spirit of what you're trying to accomplish, Senator Chamberlain, I'm not sure I can agree with this as the means to get that accomplished. So thank you.
Senator Chamberlain?
And just quickly, yeah, we just simply want to ensure, underscore, I guess, highlight in bold that we believe that it's vitally important and where they need authority. If they do need authority, the intent is to give them authority to do so. Again, it won't be easy, but we got to know where they're at, the kids are at. Thank you.
Then, Mr. Chair, can I ask Senator Chamberlain another question?
Senator Isaacson?
So my son is in first grade. I should probably know this, but I don't think he's got MCAs, right? First graders aren't given that, correct? Okay, just making sure. I was about to panic for a second there. But I can tell you that in the experience of watching him go through the year and having sat in on like hundreds of his little class meetings with his other students, you know, it just doesn't seem to me like when you think about what could be like in person and what it's like remotely, that those are apples to apples. And so my concern would be that if we're going to provide MCAs to students who have done remote school most of the time, when we all agree that it isn't the same as being there, are we going to get an accurate measure of things, right? Or is that the goal? And maybe that's the goal in your mind, is to demonstrate that they're not where they need to be, right? So I'm just kind of curious can you help me to understand that part of it? Because it seems like if we know the MCAs aren't going to match where they should be at, and we know we got a ways to go, are you thinking to yourself, well, we got to figure out where they are at all so we can make good choices going forward? Is that kind of your intent? Is that a better way to maybe say it?
Senator Chamberlain?
Well, look, no one's going to pretend that would be easy or clear. Absolutely. Again, the intent is to work forward with the intent of moving forward with the test. Secondly, for example, when we have new standards that are released, test on those new standards, the asterisk, the note is that you can't necessarily compare the test with the new standards to the previous test. So part of that is already understood in the process. But again, to the extent that we can, do the best we can to get to the place we have to be.
All right, next up, I have Senator Kunish.
Thank you very much, and thank you, testifiers. You know, this is a really tough question. This is a really complicated situation because you really have to understand the whole culture around MCAs in classrooms and within the school year. As the library and media specialist at my elementary school, I was the testing coordinator for 12 years. So I did this, you know, hands-on for weeks on end. And that's really what it takes. It takes weeks to do this testing. And if the plan is to begin MCAs on March 8th, did you say? Then that will give, I think, and the window, you know, first you have to take the reading test, and that generally took at least 2 days per grade level to do that. And then you have to take the math test, and that's another at least 2 days. And then you have to, you know, rally up all the kids that missed it. And then fifth and ninth graders have to take the science test as well. And we are in a really, you know, I don't have to tell you the kind of social emotional trauma that our kids and our families are in right now. And to be bringing like our middle school kids and our high school kids back into the classrooms now, I had to run over to the middle school that I taught at this morning and help them with a couple of things. And they're just bringing half of their 6th grade classrooms back in on Monday. And now you want to turn around and start testing them right away. That you know, I think we're going to find some pushback. And I'm just saying that I'm not against this. Yes, Chair.
Please continue. I was just acknowledging that Senator Chamberlain was going to respond as soon as you were done with your question.
Oh, yep. And then I guess I would like to find out how we will secure this test when we have it in the schools. I mean, it is like locked down. Every kid is in their room or in the library. No kid leaves to go to the bathroom unescorted. You know, you have to take down all the posters and anything that might give kids a hint or a clue. How will we ensure that is the student that is actually taking the test if we do this remotely or online? And so I think we might find that some of those results are going to be skewed. And I don't know, Chair Chamberlain, if you have discussed this with anyone or if you have any thoughts on that matter.
Senator Chamberlain.
Thank you, Mr. Chair. Thank you, Senator Kunish. Again, I'll repeat, I am not pretending it would be easy and it's going to be a simple walk down the path to get this done.
Yeah.
My intent, and I think our intent, is to let people know that they should expect to do these tests and to give the authority to the department if they need it, and to let the department also know that legislative intent is that these kids get evaluated and tested so we know what needs to be done going forward. So the technical pieces of it, there, you know, we've all taken tests through our lives, you know, when I was in elementary school and junior high and high school and ever since. Same sort of stuff. And of course, the situation was a little easier. It wasn't necessarily remote. although they do have remote sites. I don't know how that could work that you go to that are secure. But the testing window opens March 8th, I believe is the date. That doesn't mean they had to be given March 8th, but that's the window when the window opens for them to do that. And as far as the number of tests, I get it. But the OLA, just a reminder, members, OLA did an audit of this a little while back and determined that the state tests were a fraction of the number of tests that the districts offered to give to their students. So, no, I don't have all the answers, but this is just expectations, authority where it's needed, willing to tweak if we need to, but just to march forward and do what we have to do. It's going to go to the floor and we can work on it a little bit more before it gets up there. Thank you, Senator Kunesh.
Yep, and thank you, Chair and Chair Chamberlain. I hear you very much. I don't know if there are alternatives to this, maybe putting off the MCAs now, but starting in the fall, maybe starting out the school year with some kind of an assessment so that we know where we're going to start. When you take this test, they can take it between March and I believe the middle of May. They have to close. There's windows that are open for each one of those sections. Everything has to be completed by the middle of May. Then we've got summer coming up, and we know about the summer slide. And so I guess the point I just want to make is that while we need to know where to meet these kids coming forward, do we really want to put the students and their families through this when actually in the fall, it could mean absolutely nothing because of the summer slide, because of the whole school year. And so I think those are some of the things that we have to really think closely about. And if it's really worth the stress of it all. So that's my comment. Thank you.
I see Senator Uyghur has his hand up next.
Yes, thank you, Mr. Chair, and thank you, Senator Kunesh, for pointing out a lot of the issues that we all share. Senator Chamberlain, a question I want to make sure on interpretation. Are school boards required to have tests administered to students that are in distance learning in this bill?
Senator Chamberlain?
They're required to offer them. And currently, as everybody knows, parents can opt out of tests. That's current law, but the schools are required to offer them.
Okay,
Senator Uyghur?
Okay, and Senator Chamberlain, what's your response to the department's concern about security of the test? And let's say you have a third grader or a fourth grader, and maybe a sibling is there. A lot of parents, they might be at work or not there, but a lot of issues just raised about the practicality, and then what might be done with this data that may not be a fair characterization. So, I totally understand the requirement federally and the challenge, but meeting students where they are. But in distance learning, security issues have been posed, and I have talked to some school board members. I haven't had a lot of time to fully assess what associations feel, but I think we should make it clear that having them do an assessment for distant learning is perhaps not required of them given the security issues. But if you feel, maybe your response on the security issue that they posed.
Senator Chamberlain.
Thank you, Mr. Chair. Thank you, Senator Uyghur. Again, I don't have all the answers. The bill authorizes, gives one, the expectation that the test shall be held, will be held. Number two, it gives them authorization to develop or direction to develop plans to do those. And if need be, parents can currently opt out under current law. And the belief is that the kids will be back in school as the governor has directed and allowed, and the commissioner has directed and allowed for all kids to get back to school. So again, security. We people in this country have accomplished great things and gone through difficult, gone through a lot of difficulty to accomplish great things, amazing things, and it's not always easy. We don't have the answers right away. My intent is to take this to the floor, and hopefully the House picks up the same. We can work out any details as we go forward. But right now, the plan is to move forward with the expectation that this can be done, will be done, needs to be done, and that we will work out any glitches as we move forward. So do I have all the answers to the security? No, but I don't think it's an adequate excuse to say we shouldn't have them or the district should not offer them. They should be offered, and we should go forward and try to figure this out.
Mr. Chair.
Senator Uyghur.
Yes, thank you, Mr. Chair, and thank you, Senator Chamberlain, for your intent to work with stakeholders. You know, we've had a red flag raised, and we don't have testimony from the local school boards here today. You know, it would be helpful in the conversation to get that input, wouldn't you think? But and I imagine teachers.
Well, I know what they would say because they've told me already, Senator Uyghur, Mr. Chair, they've told me already they don't approve, right? The AMSD, all the normal groups have said they don't want to do it. I get it. I'm saying, the people are saying, the parents are saying, and allies are saying, Excel and Ed is saying, we need to have the kids tested. Now let's figure out how to do it. We're assuming that all the kids are going to be back in school. The parents can opt out if they want, but we're saying we need to get these kids assessed so we know where they're at. And that's vitally important to the kids. We've all agreed to that piece. But yeah, those organizations disagree. I'll say for the record, AMSD doesn't like it, and probably MSBA and all the others out there. So, I have all due respect to those organizations, but I don't work for them. I work for the parents and the kids. I don't work for the lobbyists. I love the lobbyists. There's a lot of good ones out there. I don't work for them. I don't work for the Department of Education. I was elected by my constituents. I didn't get elected by the Department of Education or a group of lobbyists. I got elected by citizens to represent them. And they're saying, we need the test. We need to know where the kids are at. And we're saying, okay, let's figure it out. We'll work together. And I'm willing to work with folks to figure out any glitches here between now and the time we get off the floor or we go to conference committee. So I'm willing to do that and make that commitment.
Senator
Mr. Chair. Yes, thank you, Senator Chamberlain. I also was elected and by citizens, and I value input from a lot of people. I wanted to raise the issues, particularly in the distance learning situation, and since the issue had been raised by local officials, and you have demonstrated, a support for them, I wanted to assure that, and I just didn't summarily dismiss that.
Oh, I know.
And so, I appreciate that. I want to get the temperature down a little bit and just see if there can be a commitment as to how this can amicably be resolved. We want to meet students' needs where they're at, and
we don't know where they're at.
We'll work on it.
Thank you, Senator Uyghur. Appreciate that. I agree.
Yeah. Thank you. I see Senator Duckworth has his hand up also. Senator Duckworth.
Thank you, Mr. Chair. I appreciate that. My question is for maybe our Minnesota Department of Education representative. If it's left to MDE, based on what you might be planning or what your organization might be looking for, what is the soonest we would expect to see some sort of statewide assessment of students under what MDE would offer as a plan?
Ms. Morse?
Mr. Chair, Senator Duckworth, I think that's what we're looking to explore coming up here, and that's why we've included that work in our policy bill. It doesn't set a strict time frame, but that's something that we would be ready to launch into right away and are very understanding of exactly what's being discussed today and the sentiments out there.
Senator Duckworth.
Thanks, Mr. Chair, and thank you very much for that open and honest and transparent answer. I appreciate it. And Senator Chamberlain, I appreciate your bill because it brings a little bit of a timeline to when we would potentially begin to assess kids again, and just give us a snapshot of where they might be as they're coming back to schools, and so that we can plan for the next school year. So I see some validity to it. Look forward to seeing what MDE proposes as a potential timeline as well. But as we say in the military, in the absence of guidance, sometimes we have to develop our own. So I appreciate the discussion and thank you all so much.
Thank you, Senator Duckworth. Senator Chamberlain, no other hands up. Would you like to move on to closing comments and move your bill?
Yeah, thank you. Thank you, members, for the questions and the input. The intent is not to get anybody intentionally wrapped around the axle, but to do the best we can for the kids and figure out a solution as we go forward with this. Take it to the floor, get to conference. Hopefully the House brings it up and we can hammer some things out in the next couple of weeks. Willing to do that, willing to listen. Thank you very much, members and Mr. Chair.
Thank you, Senator
Move that
Chamberlain.
Senate File 628 passed and sent to the floor.
Senator Chamberlain moves that Senate File 628 be passed the committee and moved to the floor. Members, please turn your cameras on and give a thumbs up so we know you're voting. All those in the affirmative, aye.
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 All those opposed? The motion does prevail and the bill, Senate File 628, is referred to the floor. Thank you, Senator Chamberlain. The gavel is back to you. We have Senator Hoffman up next.
Thank you very much, Senator Eichhorn. Thank you, members. So now a real fun one coming up. Sorry, we only have about 15, we'll get 15, 20 minutes to Senator Hoffman for this legislation. He's got a few testifiers. So Senator Hoffman testifiers are going to do as best we can, about 20 minutes. We'll be a little bit over, members, obviously. So I want to be fair to testifiers and folks who've been waiting. So we're going to give them maybe 2 minutes each, Senator Hoffman, each side. So it's an interesting discussion to go forward. So with that, Senate File 859, Senator Hoffman, welcome to the committee. Do you have any?
Thank you, Chair Chamberlain. And, I was all ready to get into the weeds on 94-142 and 99-457. And I thought Roger would be like, Mr. Chair, be like that. So Chair Chamberlain and members of the committee, thank you for hearing Senate File 859 today. In this post-pandemic world, this bill allows private nurses to work with students who have complex medical needs in schools. These nurses are already paid by either family's insurance or through MA, so there's no financial cost to the school. And then there's some written testimony from parents that you have in front of you that, take a look at those, right? And also there are 4 points that I can go through later, but in the interest of time, Mr. Chair, I appreciate you hearing this bill. And with that, I turn it over to a testifier, Gina Norris.
Thank you, Senator Hoffman. So welcome to the committee, Ms. Norris. Please state your name for the record and who you're with.
Hello, thank you, Mr. Chair and members of the committee. My name is Gina Norris.
Hey, Ms. Norris.
Yes.
Ms. Norris, it's hard to, I'm having a hard time hearing you. I don't know if anybody else is. Maybe that's just our equipment.
Are you able to hear me now?
Oh, that's better. Yeah, that's better.
Okay. Sorry, my headphones. Okay, so thank you, Mr. Chair and members of the committee. My name is Gina Norris. My family and I live in Otsego, and I am here today in support of Senate File 859 to allow home care nurses in schools. I'm just going to quick share my screen so you can see a little picture of my daughter. Okay, so this is Hazel. She's 5 years old. And I will stop sharing that if I can figure it out.
You got her.
You got her? Okay.
Yep.
So Hazel is the sweetest little girl you ever meet. At just 5 weeks old, Hazel began having seizures, and her seizures quickly turned into a diagnosis of infantile spasms. We fortunately were able to get control of the spasms with a major steroid, but the seizures still continued. Since these seizures started, Hazel had anywhere from 30 to 150 seizures a week and dozens of hospital stays. When Hazel was 2, she had laser brain ablation surgery, which unfortunately did not help with her seizures. Today, we are seeing around 50 seizures a week, and a recent EEG at Mayo Clinic confirms she's having more subclinical seizures that last all day long. Hazel is on 4 anti-epileptic medications, is prescribed oxygen, and rescue medications for emergency situations. We are very fortunate to have private duty nursing 16 hours a day as ordered by both her complex care physician and her neurologist. Both doctors even wrote letters of medical necessity to the district for Hazel to be allowed to have her home care nurse join her at school due to her medically fragile situation. The district pushed back, stating that a paraprofessional would be enough, and that the school would call the nurse, the staff would call the school nurse or 911 if emergency situations. Unfortunately, our school nurse rotates between 3 different schools, and we're very uncomfortable sending Hazel to school without her nurse. At times, Hazel requires oxygen, rescue medications, and possibly CPR with her heart rate changes during her seizures. She also has a G-tube for medications and nutritional support. Hazel will sometimes pull at her G-tube and results in a medical emergency. Because of these things, it is very important that Hazel be allowed her home care nurse to attend school with her. They are also able to recognize her many different seizure types and provide prompt medical and life-saving interventions. In addition to providing emergency medical support to Hazel, her home care nurses provide continuity of care whether she is ill, there is an illness in class, school is canceled and she needs to stay home, or during the holidays. Hazel has had many sick days, and but she was able to receive the same level of care whether she was in school or at home. And there's a major nursing shortage, and we would be devastated to lose any of our 6 amazing private duty nurses because they weren't allowed to attend school with Hazel. Currently, Hazel is allowed to attend school with her nurse after many exhausting IEP meetings and talking with the district superintendent. But they only are allowing it for preschool, which is over at the end of this year. The district staff said that when she attends kindergarten, she will have to transition to a para, and will not be allowed a school nurse to attend with her. This absolutely terrifies us. Hazel's health and safety is our #1 priority. We cannot send her without her medical support. We do not want to have her be forced. We do not want to have to be forced to find a school that will allow her nurse to come or homeschool her, because she deserves to be where she is in a class that she has friends in already. We shouldn't have to fight to keep our kids safe in school. It is my hope that Senate File 859 is passed so that families who have children with medical complexities will have one less battle to fight. Thank you for allowing me to be here today, and I'm happy to answer any questions you have.
Thank you, Ms. Norris. It is heartbreaking. Sorry for the challenges. Next up, so don't go anywhere, Ms. Norris.
Okay.
Maren Holden.
Oh, she's there for questions.
Oh, you're there for questions, Ms. Holden? Okay, all right. So then next is Jill Coyle. Ms. Coyle, welcome to the committee. State your name for the record and who you're with.
Good afternoon, Chairperson Chamberlain, members of the committee. My name is Jill Coyle, and I am General Counsel for the Rosemont Apple Valley Egan School District. Thank you for allowing me to speak to you this afternoon regarding Senate File 859, and I also appreciate the author's flexibility in considering possible revisions to the bill. As background, the Rosemont District brought a resolution to the Minnesota School Boards Association's Delegate Assembly seeking to maintain the authority of school districts to make staffing decisions regarding private duty nurses. That resolution received overwhelming support. As the 4th largest school district in Minnesota, the Rosemont School District has many students who receive care from a one-to-one private duty nurse at home. In some cases, those nurses come to school with them, and in some cases, they do not. When they come, it is generally for students with very unique needs that cannot easily be met by a district staff person, in circumstances in which the services are included in the student's IEP and where there is a contract between the district and the nursing agency. With that background, I asked the committee to consider 3 primary changes to the language of Senate File 859. First, and I'll go through them as quickly as I can. First, subdivision 3A, that's line 2.11, states that a student who receives clinical nursing services at home must receive the same level of clinical nursing services care while at school. It's just not clear what it means to provide the same level of care. This language may create a standard that's impractical and inconsistent with the requirements of IDEA, the federal law that governs special education services. It also occurs to me that there are some cares that may only occur in the mornings or evenings and may not be required during the school day. And in addition, schools have many more service providers on hand to provide school day cares, such as school nurses, program nurses, paraprofessionals, and special education teachers. Further, it's the IEP team that determines the level of services needed during the school day. It shouldn't be prescribed by a statute. And if the IEP team has disputes, if there's not an agreement on service level, IDEA already provides many dispute resolution processes to work out that dispute. Moving on, second, I'd like the committee to consider revisions to subdivision 3C, that's line 2.30. That section sets forth 3 things that a school and a parent or guardian must take into account when considering a clinical nurse. Again, I'm concerned that establishes a standard that's different than the standard in IDEA for determining what services should be included in an IEP. IDEA is already a complex statute, and requiring teams to apply additional layers of analysis on top of that law further complicates what needs to be discussed in an IEP meeting. And then third and lastly, subdivision 3D2, that's line 3.17, indicates that a school district and a clinical nursing service provider may enter into agreements regarding the nurse's conduct in the school environment. I would like to see that language tightened to affirmatively require clinical nurses and their agencies to enter into agreements regarding compliance with such things as data privacy laws, maltreatment reporting laws, background check requirements, and applicable school district policies, as well as carrying specific insurance coverage and naming the school district as an additional insured on their policies. Thank you very much for giving me time to speak today. As I said, I am not speaking against the concept of having private duty nurses in schools. We often find that these nurses serve some of our medically fragile students very well. I'm simply looking to make the bill a better fit with existing federal law and to preserve the staffing authority of school districts. Thank you for your time.
Thank you, Ms. Coyle. Next up is Mr. Jorgensen, and then wrapping it up is Assistant Commissioner Corte.
Thank you, Chair Chamberlain and members of the committee. My name is Jeff Jorgensen. I am the Director of Student Support Services at Edina Public Schools, and I'm here today representing Minnesota administrators for special education. I do want to emphasize that that MACE does appreciate the opportunity to contribute to the conversation today, and want to begin by thanking the supporters of this bill for their efforts to address the concerns raised during the last legislative session by our members. We are in support of assuring that a conversation between parents and school districts regarding how medical supports are being provided to their students occurs. So we're very much in support of that. Ms. Coyle has already identified 2 of the 5 points that I wanted to make that we would like to see addressed in some changes in the bill language. Number 1 that I will emphasize is that on page 2, lines 21, 22, subdivision 3, B1, the language states that the pupil's clinical nursing provider in the home provides clinical nursing services to the pupil at the school and during transportation to and from the school, and that such services are paid for by the pupil's home care service or other insurance. We're concerned about this because this seems to run in direct contradiction to federal law, which states that the school district the school district is to provide a free and appropriate public education. We do not believe the legislature can release the school district from this obligation, and we believe the school district cannot allow charges for the parent, or allow charges that the parent must incur for services to their child, which the child under federal guidelines. Also on page 3, lines 21 and 22, subdivision 3D3, the bill actually states that the school district bears no liability for actions of nurses under this paragraph on school premises. Once again, MACE does not believe that the school district's liability obligation to the health of their students can be waived by this bill. Finally, on page 3, lines 23 and 27, subdivision 3D4, if the clinical nursing provider or nurse is not employed by the school district for the purpose of providing clinical nursing services to the pupil who is medically fragile, the clinical nursing provider shall report to and be supervised by their clinical nursing provider employer for the purposes of providing clinical nursing services to the pupil who is medically fragile. In this case, MACE does not believe that the school district can be released from their obligation to supervise individuals working with their building and program. The MACE organization looks forward to continuing to meet with the advocates in hope of reaching an agreement on this language that meets the needs of our medically fragile students and also clarifies the responsibilities of the school districts, making any additional costs or administrative burdens. Thank you very much, and I look forward to any questions that may be asked.
Thank you, Mr. Jorgensen. Last and of course not least, Mr. Corte. Are you with us, sir?
Thank you, Mr. Chair.
Question from Senator Newman. Go ahead, Mr. Corte.
Thank you, Mr. Chair, and thank you for the opportunity to testify on Senate File 859. My name is Darren Cordy, and I'm the Assistant Commissioner for the Office of Student Health and Wellbeing at the Minnesota Department of Education. I also want to thank Senator Hoffman and the advocates who brought this bill forward for bringing up this important issue. I think we all agree that students with significant medical needs do need access to nursing services during the school day. Fortunately, there is already a framework in place to ensure that students receive those services. The Federal Individuals with Disabilities Education Act, or IDEA, requires all public schools to evaluate the needs of students with disabilities to ensure that they're receiving the services that they need to receive a free and appropriate public education. If the student's individualized education program team, which includes the student's parent or guardian, determines that the student needs clinical nursing services to receive their public education, then the district has to provide those services at no cost to the student or the family. If a family believes that their child needs additional services that are not being provided, then we have a process at MDE for resolving disputes between districts and families. We offer mediation services, facilitated IEP team meetings, complaint investigations, and even hearings in front of an administrative law judge. We do not believe that the federal government would allow our state to circumvent the requirements of IDEA and the IEP process by requiring clinical nursing services to all students who receive them in the home, regardless of what the IEP team determines. I know that it was mentioned that there would be no cost to this bill because of billing to MA or to private insurance, but we would just want to make sure that there aren't any potential costs around this proposal. Typically, requiring contracted staff to provide these services, that we know that that's more expensive than what it would cost for a school to provide these services with their own staff. So we would just want to make sure that we're clear on that. And lastly, if the IEP process that we have set out in state and federal law isn't working, then we would prefer to work with the advocates to fix that process rather than creating a new and parallel process specifically for clinical nursing services. I have tremendous respect for Senator Hoffman and the advocates who are working on this bill, and we look forward to continuing to work with them and our school professionals to ensure that students requiring clinical nursing services have access to those services. Thanks again for the opportunity to testify.
Thank you, Mr. Corte, Assistant Commissioner. Senator Newman, you had a question.
I do. Thank you, Mr. Chairman. Candidly, this bill makes a lot of sense to me. I'm a little surprised at the objections to it. So I do have a question for Ms. Holden, if I may. As I understand, Ms. Holden, you are an attorney for the Legal Services Advocacy. And my question, Ms. Holden, is, in your opinion, does Senate File 859 in fact violate federal law? And could you address some of the concerns that were proffered by Mr. Jorgensen?
Ms. Holden.
Thank you, Chair Chamberlain and Senator Newman, for the question. I think I agree with Mr. Jorgensen that it is fundamentally schools' responsibilities under the IDEA to provide clinical nursing services that a student needs during the school day. I think if you read the letters that many parents have submitted and listen to the story, the problem here is that it's simply not occurring. And so this is not intended to supplant the IDEA. This is really filling a gap in practice that we're seeing here in Minnesota. And if there are specific technical ways in which, Darren and Mr. Jorgensen and others, we feel like there may be a problem there, I'm really eager to work on those. I do see some of those, particularly about the payment. And we were hearing from districts that they were concerned about assuming costs. And so we were trying to work with districts on making sure that there were no costs borne by districts. But I do see that that's an area that we may want to look at again. Otherwise, I do not think that this undermines our responsibility as a state with regard to what we've committed to the federal government in fulfilling our obligations under the IDEA. And I think, as you've seen, the way that that families have experienced this is, as a practical matter, students, and especially young students, simply aren't getting access to school when they have to feed out a dispute with districts about whether or not a child who is eligible under either their waiver, Medicaid, or private insurance for 20 hours of one-on-one nursing a day, that whether that child's needs can be met by a school nurse who serves other students and, many other students in the building. And that I appreciate too what Ms. Coyle shared about 196. I think that's actually kind of a model for what we would hope to see, but that's simply not, as you can see from family letters, what folks are experiencing. And so that's the intent of this bill, is to fill that gap.
Thank you, Ms. Holden. Senator Newman, any follow-up?
Yeah, just a comment. Thank you, Mr. Chairman. What I heard is that the school districts are unable to provide the kind of services that are necessary, and that's the reason why the private nurses are being requested to come in and provide that service. And so it's pretty clear to me that on these medically fragile students, if the school district isn't able to provide the necessary medical care, it would seem to me that the school districts are running a little bit of a liability risk by not allowing the private nurses to come in and provide that necessary service for the protection of that child. That's all I've got. Thank you, Mr. Chairman.
Thank you, Senator Newman. Glad we now have an attorney on our committee, former attorney, law judge. So we got a couple of questions left, and we're going to have to shoot right through this, members. So next, Senator Isaacson, and then Senator Kunish, and we're going to wrap up.
So it seems like at first glance, I shared Senator Newman's thoughts about this. But as I think about it, I'm very concerned with how this gets done in a way that keeps everybody whole and still provides the services. And so my hope would be that we would find a way to work those two together. And I'm with, it does seem a little, just like at first blush, right? It does seem a little ludicrous that you would allow a health professional to be with the kid as they need it. I get that. That makes sense. At the same time, I think the autonomy of a school district to run its own buildings is super important. And I feel like there's got to be some middle ground there that we can come up with. And that'd be my concern in going forward and making sure that we find that middle ground so the kids get what they need and they're also in school. I hope that's the direction we can go. Thanks.
Mr. Chair.
Yeah. Thank you, Senator. Senator Hoffman, you want to make?
Thank you, Mr. Chair. To that point, and to Senator Newman's point, when you talk about and I was jokingly when I said I want to talk about Code of Federal Regulation 34-300, and I'm going to bring it up. 300.1 specifically says the unique and individualized needs of the child and their disability and how it affects their education, right? And it's that unique conversation, Senator Isaacson, that needs to be happening, right? So there are 4 things within the construct of this discussion. Number 1 is a due process conversation. Number 2 is a reasonable accommodation. Number 3 is a related services conversation. And number 4, having this medically fragile need, right, that is being paid from a private duty nurse or third party paying, gets rid of the cross subsidy conversation that I've heard since I was in the Bush administration, doing the stuff I did for Public Law 94-142. And so I think you're bringing up the point, and Senator Newman's exactly right there. These conversations should be happening at an IEP level, but unfortunately, they don't necessarily happen. So this is a way to say you must have these conversations. And I'm glad that Mr. Corton, you've had this information since January, and I wish I would have had a conversation with you prior to today, because I loved working with you. I miss working with you in the education world, and I look forward to working with you in order to make this thing really look what it should be focused on, which is the unique and individualized needs of the child and their disability and how it affects their education. Then that leads to, and I'm sorry, Mr. Chair, but it leads to the conversation of now we know what, now we have the conversation of how, and then who's going to do it. And that's basically the construct of an IEP or an IFSP, whatever version you're laying in. So with that, I just wanted to validate what Newman and Isaacson were saying.
Thank you, Senator Hoffman. So we're gonna go to Senator Kunish, and then we're gonna wrap up. We gotta.
Yep, I just have a really quick question. Does this need to go to HHS as well? Does this conversation need to be sort of a collaboration or another conversation in HHS?
I have not heard. I have not heard from them, Senator Kunish. Senator Hoffman, have you? Any thought on that?
No, Mr. Chair, the only way that it would have any jurisdiction is the MA side if they're utilizing medical assistance payment structure on that. But I think I have not heard, but I can find out for you, Mr. Chair.
All right, thank you. Senator Newman, your hand's still up. Did you have one quick comment, or is that just left over? Looks like it's left over. So I would say, Senator Hoffman, that if anyone can get this figured out, you can, because you know this stuff inside and out. So I'd say if you can't figure it out, it probably can't be figured out. So we got time. My plan is to lay this over, possible inclusion, but you got to work out some of these issues. I have great sympathy for the mother and other parents to that level. And as you and Senator Newman have stated, it might appear that some of these parents and kids aren't meeting that threshold, as the Attorney Holden had mentioned as well. So maybe some of those things can be clarified and tightened up.
Yep.
The other testifiers mentioned we can include in the final bill. I just hate to jam something in there that was going to cause extra problems, but I think we could work this out, or you can get it done. Senator Hoffman, any final comments?
Mr. Chair, thank you for rolling us over. That gives us a few weeks to really work out the pieces of this and get you a final product you can be proud of that can be addressing the unique needs of a child and their disability, how it affects their education. So I'm all in. Thank you.
Good. Well, with that, members, we will wrap up. Thank you for the patience again. Wednesday, we will have what we'll call a Teacher of Color Day. We got several bills that address that, some variations of others, and we'll see, sort it all out, see what we can do. So members, thank you very much. With that, Senate File 859 will be laid over for possible inclusion, and we are adjourned. Thank you, members.